Welcome back to Search Ahead and to a new conversation on breast cancer during AIDS Awareness Month. Today we will have a conversation with Dr. Chris Jenkins. He is a research assistant at the Centre for Public Health at Queen's University, Belfast. With a very interesting academic trajectory, he started his BA in politics. After that, he studied his master's on development studies, and recently he just finished his PhD in medicine at the university where he works now. Thank you very much, Dr. Jenkins, for being here, and welcome to Search Ahead.
No problem. Thank you.
Currently, you are involved in a project that is documenting how art and storytelling can save lives. This is focused on breast cancer in Vietnam. Could you just tell us a little bit about the inception of the project and how the idea came across?
The idea came about, probably have to go back a few years before this specific project on storytelling and breast cancer, but Queen's University developed a partnership with the Hanoi University of Public Health, and professor at Queen's University, Liam Murray, developed that relationship with the professor in HUPH, Professor Hoang Van Min. And one of their initial ideas was to try to understand how breast cancer services are currently delivered in Vietnam and what different challenges and barriers there are for women accessing those services. So initially we did a 3-year piece of research that looked at those questions. So we interviewed and surveyed healthcare providers at different levels of the Vietnamese health system to understand what challenges they had in delivering breast cancer services. And then we interviewed women with a breast cancer diagnosis to understand what challenges they had in accessing and using breast cancer services. And this was a highly collaborative piece of work between HUPH and Queen's. And that kind of set the foundations for this piece that came next, which was trying to develop an intervention essentially to see the impact of arts-based approach to improving breast cancer outcomes. The WHO released a scoping review of articles. I think it was 900 articles that they reviewed on the impact of arts-based approaches to impacting health, whether it was improving prevention or changing behaviours, or as a sort of a complement to treatment, and broadly found that arts-based approaches are effective in addressing those sort of issues. So there is a big, I think, like a lot of things, our research fields are very siloed. There is quite a lot of research that is done in this area, but not typically within kind of medicine. Epidemiology tends to be more within faculty of arts, art sectors, social sciences. And I think the exciting thing about this project is that it was very multidisciplinary. Like the team that worked on this, the team in Vietnam was a mix of public health researchers, epidemiologists, health economists, and then we had, at the center of it, we had a group of women with a breast cancer diagnosis that directed a lot of the project. We had artists in the form of photographers and videographers in Vietnam, and then in the Queen's side, we had people who had an epidemiology background, cancer backgrounds, but then we had people that worked in School of Music, School of English. You know, we had a really multidisciplinary background, that a team that contributed to this. We had anthropologists. So I think in some ways that allowed us to produce something that was, I wouldn't go as far as to say unique, but tried to break down those silos. Definitely, we identified a group of women who had a breast cancer diagnosis that wanted to tell their stories. Our role as researchers was that we provided them with information that we had gathered from our previous research studies on, you know, what is currently available in terms of media in Vietnam, what campaigns have already been developed, what artistic, you know, interventions have worked in other contexts, what are the common challenges and themes that are experienced by women with breast cancer diagnosis that have been shown in our previous research. We gave this information, communicated this information to this group of women with a breast cancer diagnosis. And then they kind of had the freedom to take it in whatever direction they they wanted, and they decided it would be good to do a photographic exhibition. So basically, each woman within the project, there was a series of photographs taken of her, and then a narrative provided with that. And then that exhibition was shown at a textile factory just outside Hanoi. And the idea is to now move this to a number of different settings, to share the exhibition as broadly as possible, potentially put it online as well. And we're now at a point where, again, the researchers now come back into it, where we start to look at, well, how do we evaluate this? Can we show if this is effective as an intervention? So yeah, again, like a very collaborative project, and a lot of different people with different expertise kind of contributing at different parts along that process, which I think made it quite interesting and exciting to be involved as a small part of that.
Yeah, thanks for that. And how was it when you had to talk to them, to the women, and explain what you wanted, and how did they take that for such a medical issue? They were suddenly surrounded by so many artists and people from different disciplines.
The stories that they wanted to tell were very empowering stories, which I think is, within medicine. I guess we try to promote empowering stories about women and about patients or whatever as well. But I do think that they took a slightly different angle on this. They probably used messaging and metaphors that we probably wouldn't use in medicine, but I think were very effective for the context. So a lot of the metaphor that was within the photographs and the narratives was around kind of ideas of kind of women being warriors against disease. And I think that, there's a long history in Vietnam of women within the military, within conflicts and stuff, having these very empowering roles. And I think that was kind of used within a lot of the photographs and the narrative, which we probably wouldn't do in medicine. But this was a project that they had the freedom to take it in a direction that they felt was best, and I think it was really effective. We're going through the stages now of trying to evaluate it and trying to see what messaging was most effective. But it is really a very empowering exhibition, and pictures of women getting on with their lives, pictures of women showing scars and things like that, which within any context, but particularly Vietnam, is a very brave thing to do. This was really directed by the Vietnamese team of researchers, and just an incredible team to work with, and them coordinating and liaising with the group of women with a breast cancer diagnosis in Vietnam. I think it's an interesting time in global health research, and I think there's increasing recognition, far too late, that the role of international researchers needs to change. The idea of international researchers sort of parachuting into different contexts in different countries and doing a quick analysis of what a highly complex problem is, suggesting interventions, and then going and writing a research paper about it never really worked. And it's something that is rightly being challenged a lot now. So my role in a lot of this was limited. It was to provide a lot of support and to try to help with the research in terms of constructing what sort of research we could do, what sort of questions we could ask, what methods might work, how we might analyze that. But it was a limited role. There's been a lot of discussion and debate around the need for researchers from high income contexts to lean out of research projects. And I kind of think that one of the reasons why this project was successful was that is how the Queen's University team approached a lot of this work. We really tried to leave a space that the Vietnam team could take forward these projects with support, but with a lot of their own kind of independence. Because, like, as a it's obvious, I almost shouldn't it's almost a bit of a labor to say it, but like as a white English speaking from a high income context man, I am probably not very well placed to do research on breast cancer in Vietnam. I'm very aware of that. So it's about finding the good partners, good collaborators, and knowing what bit of the puzzle you can contribute to, and not overreaching.
You're highlighting the power of storytelling, and as you pointed out in one of your papers, which is an analysis of the online media representation of these stories in Vietnam, you pointed out that there is actually a lack of these stories. And why do you think that is happening?
It's hard to say definitively. I would theorize that it's to do with kind of continuing ideas around stigma around breast cancer, women not wanting to discuss a breast cancer diagnosis, sort of social conservatism around women's bodies and things like that, and not kind of these things not being visible generally in society. So they're not by extension, they're not going to be visible within the media. I do think that's changing in Vietnam. I think if we do this again in 5 years' time, a lot of these issues will be a lot more visible. And I think, the work that was developed by the woman with breast cancer in our project really highlighted that there's a growing advocacy movement of people with cancer who are really pushing these issues into the public sphere, which is fantastic. And I think we'll do a lot to kind of normalize conversations and attitudes and beliefs, and hopefully also just increase awareness around symptoms and the need for early detection, early diagnosis, and also challenge some, again, changing but lingering ideas around cancer being incurable and things like that. So I do think it's a changing situation in Vietnam, and it's moving in a positive direction because of a lot of the work that the patient advocates have done. But the last few years, it has still, our review showed that there was still a relatively low amount of stories low amount of content on personal stories. And I think that's, there's a growing body of evidence that kind of shows that narrative approaches to public health messaging are very effective, and they work better than just purely communicating medical information. There's been a couple of studies done on this. There's a study done in St. Louis around breast cancer and mammography screening a few years ago that showed that a narrative informational messages were much more effective at kind of increasing confidence about what to expect in a mammography, encouraging people to see the value in a mammography, encouraging intention to go for screening and things like that, than an information, rather than just like a traditional medical leaflet. This is why you should go and get screening for breast cancer. You're in a group, whether it's over 50 or whatever, where you should be screened. These narrative approaches, I think there's more evidence that's kind of showing that they're effective. So we saw a bit of a disparity there in terms of this lack of personal stories, and that's one of the things that whenever we were talking to the group of women who had breast cancer about what type of project and what type of artistic project they would like to do, we communicated this, and they I think that was part of a factor for why they decided to reveal their own stories and to do so in such a kind of open and an intimate way in a lot of ways too. So yeah.
Thank you very much for having this time with us, talking about the project and about your findings and thoughts on the storytelling in breast cancer.
Thank you for the opportunity. Thanks.
And for all of you, thank you very much for having watched this conversation. We have the rest of them already uploaded on our website, where you can find them. And also you can be always on the loop of our activities and news, following us in our social media. Take care and keep yourselves safe.